This is a comprehensive dosage calculations book that uses relevant clinical examples the whole way through. We have tried with this book to keep it so that it is very real for students. So we don't separate out the mathematics from the actual client or patient that we're dealing with. We're really trying with this to have quality use of medicines and risk management as themes throughout the book. We use Australian, New Zealand drug charts and medications to highlight examples for how to do dosage calculations. And we're also trying the whole way to keep it totally relevant to the clinical context. So students can learn either using the formula method, which is the traditional approach, or they can use the ratio proportions method. So they have two options, they're not locked in. Kate and I talked about this book early on, and we tried to, look at this book in a way that no other textbook is really trying to cover all these bases. We want a really clinically relevant book, and in doing that we felt that no other book was really meeting the needs for students and nurses in specialty practice areas, specifically paediatrics with powder volumes, in critical care with some of the more complex type of calculations there, and mental health, aged care, midwifery. We also felt that we needed a book that was clinically relevant and had lots of visual appeal, and we felt that we needed to contribute in this way. What we're most proud of in this book, I think, is that it is such a visually appealing book, and that it does include such really good examples from the Australian-New Zealand context. So we've got real patient examples. We're using real medication charts, we're using real medication labels, so that students and nurses can look at these pages and can say, oh, that's what this particular medication looks like, and this is how I would work out these particular dosage calculations.
With this textbook, we're most proud of the fact that our text allows students to decide how they're going to learn to do calculations. We haven't tied them into a formula method in particular, and we haven't tied them into a ratio proportion method. We use the text to give the students an ability to choose the way they want to, and use either formula or both to check the answer that they may have got from one to the other.
If I were to show a colleague parts of this book that I really would like them to see, it would be things like the real cases, how we use real life examples of real patients, and we show medication charts and we show scenarios, we show real medication labels so that students can go through and say, oh, I see, this is this particular medication chart, and then this is the medication that it corresponds to, and they can work it out. So it's not simply saying to them, you have to give this particular medicine and it's available in this particular dose. So it really brings it to a clinical context. I'd also show them the specialist chapters and looking at how do we bring those specialist areas into dosage calculations and what the differences are there.
Students will like with the book that they get to learn how, or they get to choose how they learn to do the dosage calculations. The students will like the visual cues, they will like the colour. It's very colourful, it's very true to what the students will find out in the clinical setting, and as such it should help tie the reality of the real clinical setting in with what they're learning in a classroom setting. The students will like the online content that is given for this book as well. All of the questions through the book have worked solutions in both the formula method and the ratio proportion method available to them.
Our book is a lot more clinically based than the other textbooks in this area. It's also quite comprehensive. It covers all of the areas of dosage calculations, whereas some of the other books do not cover things like powder volumes, bolusing medicines in critical care. They don't look at how the concepts of quality use of medicines and risk management integrate into that. Our book is also different in as far as we have medication labels and diagrams of medication cups and injections that will help students to visualise how they can use this knowledge.
Our book is different in that it has the online content that is available, it has instructors' solutions and PowerPoints that are able to be used by the instructor to teach the content of the book. It comes with specialty chapters that introduce areas that are possibly not covered by other texts or aren't covered clearly, and inside these specialty areas we also give the ability to use either formulas or ratio proportion as well. So it gives the student choice. The major challenges in this area in teaching at the moment are that a student is traditionally locked into a very formal method of learning through a formula. Some students can't learn using formulas or find them very difficult to remember, and as such it moves away from a very traditional area and into giving the student a choice in which way they choose to learn how to do dosage calculations.
I think one of the main challenges in dosage calculations is that it has been so traditional in the past. It has been in nursing always the way that we have to use formulas, and in many cases students just don't know, either they can't remember the formula or they can't remember when to use the formula, and it causes a lot of stress. And so for students to have this choice to either use a formula or to use a ratio proportions approach, it means that they're not tied into learning about this in a way that it's not intuitive to them. And I think that's one of the main things with this book, that it is visual, it is geared for our Australian, New Zealand context, and it is very much about the learner and bringing it into a clinical realm.